A healthy lifestyle is as much about nutrition as exercise, and what you eat is even more important when you've had cancer. Our experts, Steve Pratt from Cancer Council WA, who is a dietitian and exercise physiologist, and Charlene Tan, clinical dietitian in oncology at Joondalup Health Campus, have a range of tips to help you with everything from food shopping to alleviating treatment-related side effects. There's also a great, easy-to-follow how-to section to get you started on cooking healthy recipes at home. So let's begin.
A healthy diet will help to improve your immune system, give you more energy levels, help to maintain your weight within a healthy weight range, and also eating well after your cancer treatment helps to increase long-term cancer survivorship.
Most of us have a fair idea of what makes up a good or bad diet, but there are a few things worth remembering.
We know that most people have a pretty good idea about what's healthy and what's not, but actually it's worth kind of rethinking those things, because we know that a healthy diet is made up of plenty of fruits, plenty of vegetables, plenty of whole grain cereals, and then modest amounts, but they're important parts of the diet, of meat and the alternatives. So you don't have to eat meat, you can be vegetarian, and dairy and the alternatives. So if people are allergic to dairy, then there are alternatives, and that's the soy, rice, almond milks.
While general nutrition guidelines cover the basics, you need to know what's right for you during your cancer treatment and recovery.
One of the things I've learned over a long time working in this area is that two people can have the same cancer and the same treatment and have very different experiences. So it's important that we do give individual advice as well as the general advice. So that general overall advice about a healthy diet and healthy body weight is good. How does that work for individuals? Some people gain weight during cancer treatment and some people lose weight. So actually what we do talk about is over the duration of treatment is weight maintenance.
We advise patients to maintain their weight within a healthy BMI range, and BMI stands for Body Mass Index. There's lots of tools online which you can use to calculate your BMI. So if you know your height and weight, you can hop on the internet and work out your BMI. We know that there's lots of negative health effects associated with being underweight or being overweight and obese, so we recommend the importance of keeping your weight within the healthy weight range.
A typical cancer survivor is actually like a typical member of the community, and that's in terms of drinking alcohol, in terms of the diet, exercise, body weight, all of those risk factors. We know that cancer survivors aren't actually that different.
Nutrition is also important in helping you to prevent other chronic diseases.
We need to make sure that people reduce their risk of other diseases in the future, and a lot of people finish cancer treatment and live very long lives afterwards, and we need to make sure those people keep their risk of heart disease and type 2 diabetes and other cancers, as low as possible. If you've spent 25 years or 30 years not exercising or eating not great, then we know that your risk of those diseases increased as well. So cancer treatment and recovery often does offer a time when people can really make some of those changes to their lifestyle and live a healthy life.
Osteoporosis is a condition that can make your bones more weak and fragile. It is a condition that can occur with age and menopause as well. And we know that certain types of cancers, such as ovarian, breast cancer, can also increase your risk of osteoporosis. So to reduce the risk of osteoporosis, we recommend patients consume 3 serves of dairy a day. So 1 serve of dairy is 1 glass of milk, a thin slice of cheese, or 200-gram type of yogurt. Vitamin D is also very important because it helps in the absorption of calcium. So vitamin D, a good source of that would be from the sunlight. The Cancer Council recommends getting about 5 to 10 minutes of sunlight per day. And please remember to be sun smart as well. Some of the dietary sources of vitamin D would include your oily fish or even your dairy products as well. So other things to remember as well to reduce the risk of your osteoporosis is to limit your intake of alcohol and caffeine, as they can impair the absorption of calcium in your body.
In essence, a good diet can help you achieve a better quality of life.
Quality of life is a kind of catch-all term that's just about people's life experience, I guess, and so in a broad sense it's about happiness. And we know that people who have a healthy diet and people who exercise tend to be a bit happier and have better quality of life. So we all like treats in our diet, and diet isn't just about nutrition. Diet is about culture and interaction and socialisation and all those types of things. And what we all have to do is balance up what is important in terms of the nutritional health versus what is important versus the kind of social, cultural health. And in many cases those are compatible, but it's about minimising the kind of extra foods we eat. So that can be alcohol, it can be sweet foods, it can be those savoury foods. Kind of having fewer of them because when we do have them, we enjoy them. And really making the bulk of your diet those core food groups.
Diet can also be key to managing the side effects that many cancer patients experience during treatment.
People who have been treated for cancer often do experience side effects that last a while, but in almost all cases those side effects can be tackled and can be treated, and so it's important for people not to give up.
Some people feel a lot better after the cancer treatment. We know that up to 75% of patients continue to experience symptoms such as pain, fatigue, or even nausea after the treatment as well. For some people, these symptoms will resolve after a few weeks, whereas for some others it may take up to months or years to resolve.
Let's address some of these side effects and hear some quick tips to help you control them. Starting with a very common one, nausea.
So if you're struggling with nausea or vomiting, try and see your GP and get some anti-nausea medications. Other good tips that you can try is also to have small regular meals because they are a lot easier to tolerate. So try and avoid drinking too much fluids with your meals as well, as they can fill you up and make you feel sick.
Here are some other tips to reducing nausea. Try to avoid strong flavours or food that is spicy, greasy or oily. Eating cold food such as sandwiches or yogurt should help. And there can be a place for dietary supplements. Fatigue is common amongst cancer patients. So what do you do when you don't have the energy to cook or even eat?
After your cancer treatment, you can still continue to feel weak and you don't feel like getting into the kitchen to cook. So a good way is to maybe get your family to come in and help you with some cooking, or even try and get foods like frozen meals, frozen veggies, or even tinned fruit, and stock your pantry up with those kind of foods as well. So they're there and it's convenient for you when you feel like eating.
What if you're struggling with a loss of appetite?
So if you're struggling with a poor appetite, the most important thing is to have small regular meals throughout the day. So small frequent meals will help to get nutrients into you and optimize your daily intake as well.
Maybe your sense of taste has changed.
Common comments I hear from patients with taste changes will include things like food all tastes the same, meat has a metallic taste, or food tastes like cupboard. So some of the things that we advise patients would be maybe to try and marinate your meat before cooking so you're getting the extra flavours in. You can also try and add in extra herbs or spices, garlic, onions, or different kinds of flavourings to try and make your food taste a bit better.
Sometimes the smell of food can put you off.
If the smell of food turns you off, you might want to try colder foods which tend not to have a stronger smell, such as sandwiches or even salads and yogurt, because they are still nourishing but they're not strong smelling, so you don't get turned off by it.
You might be trying to gain back the weight you've lost.
From a dietary point of view, you will need to include sources of protein and energy in your diet to help you maintain your weight. Good sources of protein and energy includes meat, eggs, dairy products, chicken, poultry, or nuts and seeds.
Here's how you can combat a dry mouth.
Dry or coated mouth can be a result of radiation therapy, chemotherapy, or certain medications as well. And if you have a dry mouth, there might be a high risk of getting infections such as oral thrush. So if that's the case, speak to your GP or your nurse and see if they can prescribe artificial saliva to help moisten your mouth up. Another important thing is mouth care, so try and brush your teeth regularly and also gargle with products such as biotin as well. Other useful tips that you can try is to add extra gravy and sauces into your meals, and maybe trying things like pureeing your meals or just mixing your meat up so they're a lot easier to eat.
You might be suffering from a sore mouth or throat.
So if you have a sore throat or mouth, it is important that you avoid salty food, acidic food or really spicy food, as they can tend to aggravate your throat.
Maybe the problem is constipation.
So if you're struggling with constipation, we advise to increase your fibre and fluid intake. So one important thing to remember is try and get in 8 to 10 glasses of fluid per day, and that can include water, your soups, your tea, wick tea, or even things like jelly as well, because those are all made out of fluids. Another important thing to note is to have plenty of fibre, so make sure that your fluid is based around whole grain and wholemeal food products such as breads and cereals, wholemeal pastas and noodles, and also having lots of fruit and vegetables in your diet as well, so aiming for 2 fruits and 5 vegetables. Some of the high sources of fibre would include your potato, and make sure you leave the skin on your fruits as well, so these are all good sources of fibre.
Or diarrhea.
So when you're struggling with diarrhea, try and cut down the total amount of fibre that you're getting in your diet. So replace your whole grain or wholemeal varieties of breads and cereals with white varieties, so using white bread instead of wholemeal bread. And also try and leave out the skin from your fruit and vegetables as well, as they are quite high in fibre. One thing to make sure is to consume enough fluid, so you're getting enough fluids to replenish what you've lost, and aim for about 10 to 12 glasses throughout the day.
Sometimes you may need help in getting all of the nutrients you require. This is when supplements might be beneficial.
If you're underweight, or you're losing your appetite, or you just struggle to get in enough nutrients, we'll recommend high protein drinks. And these drinks can be easily made up at the convenience of your home. So you can also try commercially available supplements as well, and there's a range of different supplements out there. Examples will include Ensure or Sustagen, so it is best to speak to a dietitian, and they will be able to advise you what is more suitable and where you can purchase them from.
Finally, let's get some tips from Steve Pratt to get you started on healthy eating.
There are some tips that people can use, and there are some things that we know work to help people improve their diet. One of the really big ones is actually to start reading food labels. And that does, if people do start to pay attention to the ingredients list and to that nutrition information panel, we know that people do start to choose healthier foods. And there's some really simple and quite old-fashioned advice. Things like, don't shop hungry is a really important one, because when people shop when they're hungry, they buy more of the extra foods.
So you can see that nutrition has a vital role to play in helping you to recover from cancer and to help you reduce your risk of other diseases. If you're unsure of the right diet for you, consult an accredited dietitian for advice.
So eating well after your cancer treatment will help to keep your immune system strong and also help you feel much better as well.
A healthy diet is really important after cancer. Make the changes today and it could just save your life.